The content of this podcast has not been evaluated by Health Canada or the FDA. It is educational in nature and should not be taken as medical advice. Always consult a qualified medical professional to see if a diet, lifestyle change, or supplement is right for you. Any supplements mentioned are not intended to diagnose, treat, cure, or prevent any disease. Please note that the opinions of the guests or hosts are their own and may not reflect those of Advanced Orthomolecular Research Incorporated. Welcome to Supplementing Health, a podcast presented by Advanced Orthomolecular Research. We are all about applying evidence-based and effective dietary, lifestyle, and natural health product strategies for your optimal health. In each episode, we will feature very engaging clinicians and experts from the world of functional and naturopathic medicine to help achieve our mission to empower people to live their best lives naturally. If you are someone who suffers from frequent digestive problems, you know the daily challenges and the potential embarrassments that come with these issues. IBD Relief provides an innovative and effective combination of ingredients to help those with food sensitivities and intestinal inflammation to manage the symptoms and prevent exacerbation of the condition. Find relief today at your local retailer or online at aor.ca. Welcome to Supplementing Health. Today we are joined by Dr. John Brown to discuss ADHD and the connection to the gut. Known as the MD with ADHD, Dr. Brown was diagnosed with ADHD herself while completing child fellowship program during her early 30s. As a result, she possesses a unique understanding of the frustration surrounding treatment and the need for compassion and ongoing care. Welcome, Dr. Brown.
Thank you so much, Casey. It's great to be here on the platform. Thanks for having me on.
So having your own diagnosis of ADHD gives you a really unique advantage to treating your patients, as you can sympathize with and fully understand what they're experiencing. So did you have an interest in ADD and ADHD prior to your own diagnosis?
I actually did not have a specific interest in ADHD. I had more of just a generalized interest in treating children and adolescents with mental health conditions. My interest in ADHD became more, I would say, specific when I was in the second year of my actual private practice. I was an individual proprietor at a private practice, and I realized that there were not many resources in our community that would help parents, their children, and even adults manage their ADHD symptoms. And I actually live in the fourth largest city in the United States, which is Houston, Texas. So even with that being stated, there were a rarity of resources that would allow people to have a comfort and safe and appropriate management. So that's when I started my own private practice, ADHD Wellness Center.
Okay, awesome. And for our listeners, can you explain what the difference is between ADD and ADHD?
Sure. So ADHD stands for Attention Deficit Hyperactivity Disorder. ADD is Attention Deficit Disorder. So ADHD has three subtypes. So when we look at the three subtypes, there's ADHD, predominantly inattentive type, which is formerly known as ADD. All right. And then you have ADHD combined hyperactive type and ADHD hyperactive impulsive type. So when we look on the umbrella of ADHD, ADD is the predominantly inattentive type. And so it's only just a change in nomenclature, the change of name, but it still exists. We treat ADHD the same as ADD. And so there's really no specific difference other than how it's presented. ADHD, predominantly inattentive type, formerly known as ADD, where people have distractibility, more inattentive focus. They may have forgetfulness. It's hard to stay attuned or attention in meetings or in class. So it's primarily the difference is the actual symptoms that are more focused with ADHD, predominantly inattentive type, than ADHD combined or hyperactive impulsive type.
Okay. What causes ADHD? Is it a genetic condition, or are there different elements of a child's surrounding that can induce it?
That's an interesting question, and research is still ongoing, but we do know it's multifactorial, which means there's a variety of causes that we're finding that relate to ADHD. So, in addition to genetics, there are environmental causes. When we look at genetics, we look at parents, and if there's a parent with ADHD, then there is anywhere from a 30 to 70% chance that their child may have ADHD. So, it's not just based on genetics, but it's also based on environmental causes, such as in utero exposure to smoking. So if mom is pregnant and she was a smoker, that may increase the child's risk. Alcohol use in pregnancy, maybe nutritional deficiencies, low birth weight, premature births, brain injuries we're finding may have a link to ADHD. So there's a variety of genetic and environmental factors that may contribute to the actual condition.
And what age are kids usually diagnosed?
I actually evaluate children as young as preschool, and the reason is because they're in school. I often see when kids are in school, when they're around other kids, when they have to stay attention or have to sit down, that becomes a problem, not just for the child, but for the environment. They may be distracting other students, or they may not be learning optimally. So I have evaluated children as long as ADHD is as far as preschool, so that can be 3 years old, but I don't necessarily start treating until age 5 or 6, just because for me, professionally and personally, the brain is developing expeditiously. And so even though there are certain studies that have shown how effective certain treatments can be, such as medication management, usually around that time, I would start with behavioral management, maybe be referred to a behavioral specialist. But yeah, children in this age group usually can come to my office when they're challenged with severe and frequent behavioral concerns. However, diagnosing ADHD in younger children, like around age 3 or 5, can be difficult because many preschool children naturally have some symptoms of ADHD. So also a child's behavior and developmental change can change very rapidly during preschool years. So it's very important that even if the diagnosis is established that young, that there's ongoing evaluations with that child and their child's family.
Okay, yeah, that makes sense. Now, ADD or ADHD are terms that people kind of throw around flippantly. And I think because of that, there is, to a certain degree, a perception that it's like a catch-all diagnosis. And because, it's like someone gets distracted, they'll be like, "Oh, I'm so ADD." And it's said so flippantly, whereas it is a real condition, obviously, that people are having to deal with. So what are the signs and symptoms that actually are true to ADHD versus someone that's just using it as kind of a offhand phrase?
Yes, it's a very good point that you made. So I want to add to that before I get to the certain signs, because children are very natural, full of energy, right? Highly talkative, impulsive. It's very typical for a child to require reminders for completing a task, or even needing assistance with locating a toy that they misplaced, and encounter challenges with sitting still at the dinner table. So you're certainly right when you say that or describe it. I will say that ADHD is the most common mental health disorder or condition in children, but it does not mean that the majority of children have it. So one way to know if your child has ADHD is through a series of evaluations with a mental health professional that's clinically trained to evaluate for this condition. And although they may have some symptoms that may look like ADHD, it may be something else. So that's why it's important to connect. But commonly seen in children, this condition shows more specific symptoms of inattention or hyperactivity or impulsivity. Again, the previous subtypes that I mentioned before. Symptoms must begin before age 12. Previously, this was before age 6. We found that, especially with females, that symptoms were not necessarily as prominent or visualized as in boys. Now, that does not mean that boys don't have the predominant inattentive type, such as daydreaming or looking off in space, or not, looking at the teacher but thinking about other things, distracted by their own thoughts that are going on in their head. We were seeing that a lot of girls were having these conditions, and therefore the condition or diagnosis was missed. So now we saw that with older kids around the age of 12, that these symptoms, that's what actually became a little bit more prominent as they near towards pre-adolescent age. So that's why one of the reasons why the diagnostic criteria went from age 6 to 12. But the interesting phenomenon is that symptoms have to be consistent, and they must occur for more than 6 months in at least two settings. So when you think about children, those main two settings that kids spend the most time in is at home and at school. When you think about adults, it's usually at home and at work, right? Or school sometimes. And usually what the doctor does is that they compare the symptoms of particularly child's behavior with that of other children the same age. So yeah, that is subjective, right? A subjective evaluation as well. So not only or subjective evaluations are taking place with the doctor, but the doctor may also provide what we call rating scales to be given to teachers, coaches, grandparents, any adult that knows that child very well as the child may actually fill out some forms himself or herself to get an understanding if objectively if this condition is prominent with that particular child. Children with ADHD have major problems in one or more areas of their lives, such as school performance, but also we see some problems in friendships, relationships with family. And again, they must interfere with the child's ability to function. So not just at school, not just at home, but also in friendships and social areas, social circles. So sometimes if they're involved in soccer game and they're not paying attention to the coach or they forget to play, then if it's consistently that this is a problem for at least 6 months, then we're able to establish diagnosis. So there's a lot that goes into this. And I do want to warn parents and even adults who are going online and doing assessments that take 5 minutes, that's not enough to establish diagnosis. That's actually a risk of misdiagnosis. Teeny tiny words you may see at the bottom of those online forms that you need to seek a professional. And this is the reason why, because we have certain criteria diagnosis or diagnostic criteria, that goes into how we establish diagnosis because it can be a chronic condition.
And so earlier you were talking about how children's brains are still developing, right? So someone who maybe displays some tendencies in preschool or early ages may not necessarily end up with a true diagnosis. Does that mean that a kid could actually grow out of ADHD or that it could be cured?
No. And I said that it can be a chronic condition, and I want to refute that. It will be a chronic condition. ADHD does not, you can't grow out of ADHD. It doesn't go away. And you don't just develop it in adulthood. It's always been there. You're born with the condition. And so when I was diagnosed at age 31, I was in denial. I actually saw 3 professionals because I just did not believe that all of a sudden this condition could come on. And here I am in my psychiatry fellowship, child fellowship program, and I opened up a clinic for ADHD kids. So, even in my own denial, I could not believe that this was something that I had. But other than denial, it became my sense of normalcy. So it was normal for me to get up early in the morning at 5 a.m. and start my day. It was normal for me to study for 5, 6 hours straight with intermittent break periods. It was normal for me to check on things over and over again because I knew that, I would forget, or likely forget. So I developed a pattern of sense of normalcy that was, normal for me, but maybe not for someone else. So instead of using the word normal, instead of using the word crazy, I use the word what's natural. What's natural for the human being? What's natural for the human mind? So that's important to recognize as well. So it's not natural for someone to have these symptoms and function optimally. So it's something that you don't grow out of. It's always with you. It may become more prominent like it did for me when I actually went into medical school and I failed my boards 5 times in medical school. But then when I was treated, then I aced my boards and scored the top 10% of my written boards for 4 years after I graduated. So it can be a difference between failing, succeeding. It can be a difference from a person not forming optimally to forming their super best. And so this is something that really truly is something that can be life-changing, and it should be treated as such. It is a condition that does not go away. So it is important that if you find that if you feel or suspect that you do or your child has ADHD, there's no harm in being evaluated for the condition.
Your situation actually kind of made me think that cultural norms would probably influence how quickly you might notice as well, right? Because if you're in maybe even a corporate culture where it's conducive to what's natural for you, you may not notice those symptoms the same way as if you're in a different corporate or educational culture that kind of clashes or goes against what you would normally do or find natural for your situation.
That's definitely right. And I would even start back when my parents put me into Montessori school. You know, I started Montessori school, which is a creative school where you're necessarily not doing the students are not doing the same coursework and they're not taught the same. It's like you're on your own creative journey and it's very hands-on. And then I went to public school with a magnet program. So if you can just look at the structure, the pace, the one-on-one training, even at an early age, this is something that could have been math, you know. And so, unfortunately, my mom passed 13 years ago, so she's not here. But she was into academics. She was an educator. She was a dean of students. So, she picked my teachers. So even having that type of influence, could really have guarded me and actually masked the condition. And then here I am in college. I attend Xavier University of Louisiana, and it was a very small, private, Catholic college as well. And then I went to St. Louis University School of Medicine, which is a Catholic. You see where I'm going with this? So there's a lot of structure that actually allowed me to function optimally. And so even in school, with that structure, I was able to succeed. But it's not atypical and it's not unusual for many people with ADHD to be entrepreneurs. Like, I'm a serial entrepreneur. I've owned 3 businesses because I do things on my own terms. I have the autonomy to, schedule my own schedule, structure things how I want, and function within my own optimal level of functioning as well. So yes, you're exactly right. When you're in corporate America and the structure's already pre-created for you, yes, you may be able to be optimally function. But even an actual entrepreneur, when you have to schedule your own pace, your schedule, sometimes we struggle, but we also function optimally when we know that our condition is managed as well. So it's an interesting condition, but I also call it amazability. I've coined that term because I don't look at it as a disorder. I look at it as a condition that if it's managed properly, it really can be amazing for people.
Awesome. And so knowing that those environmental factors can really influence the condition, do lifestyle factors like exercise, sleep, diet also make a difference for people with ADHD?
Oh, most certainly. It makes a condition. It makes a difference for every one of us, with or without ADHD. It's how we function healthily. We have to eat, we have to sleep. Those are 2 things we cannot avoid, right? And so sleeping well, having fulfillment of sleep is important. It's interesting because some of the idiosyncrasies of ADHD, a lot of us have problems going to sleep because we're very creative people. We like to stay up at night. It's quiet at night if we live in a household full of people. It's our time to focus, and a lot of us just become very creative. We're motivated, we have a lot of energy, and we do things very well. So you find a lot of us are late owls or night owls that people refer to. But it's also important that we sleep as well, because when we don't sleep, it doesn't interfere with our ability to have great clarity of thought, good mood stability, being on point and in tune to time and task management, and our productivity performance can be impacted as well. Same thing with what we eat. What we eat is important. It's important that we get a well-balanced meal that is conducive to good health, our immune system, and that we feed our personality. I always tell my kiddos that I say, yeah, it's important to eat breakfast because you have to feed your personality. And unfortunately, a lot of my kids don't eat breakfast because they're running late at the beginning of the day trying to get to school. So, the condition can interfere with what we're supposed to do that can be healthy for us. But what I do with my patients, I do ADHD coaching with them as well, behavioral management techniques such as this, to train them it's okay. We just have to start at night to get ready for the next day. And so there's just simple things that we can do to prepare to get that good diet and exercise and sleep, excuse me. Exercise is also important. I mentioned that in my book, ADHD Lifestyle Series, that exercise is so important. And I love karate, especially for my kids. It's a good, healthy way to stay fit, to get that heart pumping. It's good for discipline. It's good for award system with the colors of the bell, and then peers. And so exercise is a really good, I would say, condition or task that we can definitely use for healthy wise, but it's shown to be beneficial for people with ADHD and make a huge difference.
Awesome. I love that you said, you're feeding your personality. I think that's so awesome. And it's true, really, because the food we eat, it does influence if we're energetic or lethargic, or maybe if you're grouchy, And so I think too, when you have a condition like ADHD that already has an impact on how your brain is firing and the way you're thinking and interacting with your environment, it's important to keep that in mind when you're choosing the foods you're choosing. So I absolutely love that. I'm probably going to start adopting that if you don't mind.
Please do, please do.
And on that topic, we've learned a lot more about that gut brain connection as well, right? That when we're feeding ourselves, we're doing more than just nourishing like our muscles and our cells, but we're also nourishing our brain and the processes that it handles as well. And we've learned about the microbiome, and obviously science is still exploring that and learning all the roles that it actually plays within the body. But I was curious, is there any research available yet that speaks to that connection between the gut and ADHD specifically?
Research about gut brain health, particularly as it relates to ADHD and other disorders, is promising and yet emerging, but not fully proven, like you're saying. So we know there's a connection, but the full impact of that connection is not currently entirely established. But it appears that our immune system is playing a huge role in overall health of our body and brain. So our immune system, we know, fights off infections, right? We develop these white blood cells that help fight off the infections that we may encounter. But we've also found out that our gut microbes are so important that they may be influencing or even help programming our immune function. So I find that this to be awesome research. I think that there is a strong connection to the gut immune system and how our cognition, how we think, how we behave, there's a strong connection. I will say that each individual's bacterial makeup is very different. And so there are chronic diseases such as ADHD that actually can be traced back to our gut health. So for this reason, a person with ADHD may experience the effects of an unhealthy gut. So the nerves that connect the gut to the brain drive brain circuitry involved in our learning and how we memorize information, as well as how we manage or regulate our emotions. So since ADHD involves like challenges with ability to control emotions sometimes, or a child forgets to bring school books, like our memory part, or even adult that maybe, acting without considering the consequences of their action. The importance of keeping a healthy gut as healthy as possible is so important, because if our gut is not healthy, we're not healthy. So all of these things are ongoing, but yes, there is some wonderful research out there that is showing us that the gut, in how our moods, anxiety, cognition, even pain, how they're actually a role for the gut micro.
And you mentioned the immune system there, so that made me start thinking about inflammation. And we know
Mhm.
inflammation is another thing that's been tied to a lot of chronic illnesses or health conditions. So I was just curious, has inflammation been flagged at all to have an effect on ADHD?
Yes, ma'am. I don't know if you've heard of like leaky gut, IBD, which is inflammatory bowel disorder. These conditions have a sort of inflammation to them. So the biggest problem is that they may be difficult to diagnose because there's not specific criteria for leaky gut or specific criteria for IBD that comes into play. But what we're finding is that there are certain symptoms or conditions that are associated with each of these I would say, medical conditions. So, for example, and I'll just go into leaky gut because I'm very interested in leaky gut syndrome. Because I see a lot of kids that actually may be presenting with this that come to me, and they come to me for behavioral problems. They come to me because they're not eating well. They have problems with memory or just problems with staying focused or sitting still. So leaky gut is a variety of conditions in your body. So one of the lining of your small intestines becomes damaged, or undigested food leaks into your abdominal cavity. Now I know this sounds a little nasty or crazy, but this actually can lead to toxic body waste getting to your bloodstream. And guess where the bloodstream goes? All over your body, including your brain. And so not only is this caused by food, but it can be caused by a person taking antibiotics for a period of time, aspirin, or even steroids, because these things can irritate the lining of a person's digestive system, right? So leaky gut can also happen when your body reacts poorly to the food you eat. So if your food, or excuse me, if your body develops an immune response against soy or gluten or even dairy products, then these can also invade the immune system as well, right? And so, such as, produce symptoms such as diarrhea, joint pain, chronic fatigue, or even irritability. So, yes, Casey, I can go all and all into this because I'm so fascinated with this. Because the reason why is, as a psychiatrist, we go to medical school so we can evaluate if medications can be helpful. And part of that evaluation, being a psychiatrist, is that we have to know all parts of the body. We have to know the brain, the gut, how the heart responds, how the blood pressure responds to medicines we treat, even other medicines that people are taking. So psychiatrists are fascinating because we don't just focus on the mental part. We have to be very, very knowledgeable about all parts of the body. And that's why I wrote my book, because it's not about just all about medicine and treating this, but if I can get to the wound of the infection, then, or excuse me, not just putting a band-aid on the wound, but if I can get to the cause of what's causing the wound, then I'm all for it. And that's partly why I wrote my book. So can we avoid certain foods? Can we sleep better? Can we exercise better? Like, all these things are so important. And they also help our immune system. So yes, there is a direct connection that we're finding.
The fact that the body is so interconnected is one of the things I find most fascinating and exciting about it, honestly, is that any symptom is never really the cause of just one pinpointed item, right? There's usually so many different factors at play. And I think it's really cool that science is starting to, and like healthcare in general, is starting to recognize that and go more of this holistic route where it's looking at, like you said, not just that mental health aspect, but what other parts of your health are playing into that, and how can we address your symptoms at their actual root cause rather than just mask them with medications or other treatments.
Yes.
So then, speaking of diet, and I mean, outside of IBD and leaky gut, are there certain foods that can help reduce the symptoms of ADHD?
Yes, I will say this, if you don't mind, if I can change that to certain strategies, because I like to include foods. So I would say that, yes, there are certain foods that can help minimize ADHD, but don't treat ADHD. They can help minimize the symptoms. So sugar. I love sugar. I love sweets. I love chocolate. So I can put myself right here in the forefront. I have ADHD, I'm moderate ADHD actually, and I love sugar. But sugar doesn't necessarily cause hyperactivity, right? It's a myth. What studies have examined about this idea, they found that sugar does not cause the symptoms, but several studies have concluded that sugar may cause periods of hyperactivity in children, followed by sedation and inactivity. So it's kind of like a huge drop off. But sugar also impacts other aspects of health that we mentioned, such as bloating and inflammation, cause weight gain, create cavities, and other health insensitivities related to ADHD. Now, I also realize that sugar is almost every product that we consume. It's also disguised in every product. It ends with oats, glucose, sucrose, fructose, right? It's one ingredient that's hard not to eat and can be rather addictive. So I crave the 3 C's: cakes, cookies, and chocolate, right? And when I reach my
Don't
20s,
we all?
all right? So there's a reason why sugar's in everything we eat, you all. It's a reason. They want you to buy the product. They want you to buy their product. So I noticed when I was in my 20s, I included less sugar in my meal plans. I actually lost weight and I felt great. I really felt great. So although sugar is an ingredient that I still crave, I'm more conscientious of how it impacts my thoughts, my mood, my weight, as well as my overall optimal functioning. Gluten. Gluten. So a myth is that gluten-enriched foods can cause ADHD. No, that's the fact is that for many years, gluten-free diets have been suggested for ADHD symptoms, but studies, I believe back in like the early, like 2010, 2011, they concluded that individuals with both celiac disease and ADHD saw an improvement in their ADHD symptoms following treatment for celiac disease. However, gluten-free diets did not have an impact on ADHD symptoms if the child did not have celiac disease. So there's no direct association with celiac disease and ADHD, although both conditions have been associated with food allergies. And I wanted to include that here, not necessarily in minimizing ADHD symptoms, but a lot of people or a lot of parents are giving their children gluten-free diets. It's not a bad idea, but it doesn't impact their ADHD unless they have celiac disease. That's the point I wanted to make. Watch out for artificial colors and preservatives. I would say stay away from that. If it's a can, it has a date on it, throw it away. Shop on the outside of your grocery store. That's where the fresh items are. Try to stay away from the middle of the grocery store. That's where all your cans and preservatives are, okay? So yes, artificial preservatives can cause ADHD. No, they can't cause it, but what we're finding is that there's certain sensitivities that kids with artificial, remember we talked about the gut, right? Certain sensitivities to artificial colors and preservatives are found with people with ADHD. So they may have an effect on increasing activity and focus difficulties, but they don't necessarily cause the condition. They just may exacerbate the actual symptoms. There's another thing about organic conventional foods. Now we're finding that preliminary research are suggesting that like pesticides may play a role in actual causing ADHD as one of the environmental factors, but there's a certain relationship has not necessarily been confirmed. So what I've been recommending is just like eating a veggie wash or using a veggie wash, excuse me, and choosing organic foods can help reduce pesticide exposure for children and also expected moms, okay? So some of those things can be helpful. But if you don't mind, I would like to just talk about a little few strategies because I think that these strategies can also help improve gut health, right? And that's the link that we're finding with ADHD. So chew your food slowly. Chew your food slowly. This can actually maximize digestion by being in a relaxed state while eating, taking small bites and thoroughly chewing your food. When I was young in elementary school, I remember I was always being criticized for eating slow and being the last one, but there's a reason. I was maximizing my gut digestion, not even know it. So this can actually help with gut health. Identifying inflammatory triggers from medications and foods is very important. So like if you're giving a child something to eat that has something in it that they're allergic to, they may have diarrhea or say their stomach hurts. So that's that's causing an inflammatory trigger. Their gut is not necessarily absorbing it well. So those are maybe markers. And I would also say that for parents of children with ADHD, that you're definitely not wrong with steering your children towards a healthy diet early on. I love Greek yogurt because it contains live cultures, but you also can be creative by incorporating it in your child's diets. You can create smoothies, combine it with fruits. So it's really a great nutrient probiotic food supplement for your child that has live cultures in it. And then also include meat in their diet, but just don't eat too much red meat. More fish, like mackerel or salmon. They're very good options for kiddos with ADHD. And try to make sure that their plate is colorful. So I kind of mentioned that in my book too. So make sure the plate's colorful. Make sure that they have plant-based organic foods are ideal. Eating less, of course, again, artificial food, colors and additives and refined sugars. That will not cause them to have hyperactivity, but also those things, if you create a healthy, balanced, colorful plate, it will definitely decrease the risk of overgrowth of these microbes that we were talking about before and lead to a healthy balance of having these microbes in the gut. Taking supplements are great. Flintstone supplements are really good for kiddos, any kiddo. And it's not all about food, but it can be about stress. So make sure that stress is maintained. Make sure that you balance your day as much as possible.
Awesome. Those are awesome tips that you've shared there. And I think they're good for anyone, not even just kiddos with ADHD, but it's just for a healthy, balanced lifestyle. Those are great tips to incorporate. Now, you had mentioned your book. Do you mind sharing the title and where people could find that?
Sure, it's called the ADHD Lifestyle Series, Volume 1, Secrets from an MD with ADHD, Building Balanced Meals and Exercise Routines for Children. You can actually find my book on my website. That's www.drdawnpsychmd.com. It's DRDAWN, P as in Paul, SYCHMD.com.
Fantastic. And is your website the best place for them to get a hold of you as well if they want to work with you?
Yes, ma'am. They can actually contact my website, or there's a contact form on my website, and I would look forward to answering any questions, addressing any concerns, and working with people who are all about making this a condition for our kids and adolescents and adults, that we're going to change this so-called disability into an amazability.
Fantastic. Well, thank you so much for taking the time to chat with me today and share your expertise. I think it's a really great conversation that we've had, and that it's something that affects, like you said, so many different children and people, both adults and children. And so I really appreciate you taking the time to share your knowledge with myself and our listeners today.
Well, thank you for having me. I really do appreciate it, and I had a wonderful time with you.
Thank you for listening to Supplementing Health. For more information about our guests, past shows, and future topics, please visit aor.ca/podcast or aor.us/podcast. Do you have a topic you want us to cover? We invite you to engage with us on social media to request a future topic, or email us at marketing@